laboratory in which you walk every day, your feet. If you have time before you walk your indoor-outdoor foot reflexology mat, it is an excellent idea to self-acupressure massage the soles of your feet. And let's just go through how you do that. Always begin with the big toe. You can take your thumb, begin with the big toe, and what you're looking for are any areas of soreness or grainy structures that may indicate toxins that have lodged themselves in those nerve roots we talked about in the introduction of what is foot reflexology. So just move around the ball of the big toe. That's all about the brain power, the pituitary gland, the pineal gland, your endocrine orchestra. Then we're going to go to the base of the big toe. That's our neck, big area of soreness and pain for those of us who work on computers too long, read our books, perhaps sit in comfortable positions in our cars, at our desks. And then we're going to go to the base of the second and third toe, all about our eyes, specifically the opposite eye. So if I'm working on my right foot, this is all about the left eye. There's a crossing at the base of our brain, but don't worry about it. The most important thing, other than learning neuroscience, is to acupressure the soles of both feet before you begin walking your reflexology mat or path. And then the base of the fourth and fifth toes, all about hearing and our ears, how well we hear, if we have ringing in our ears, if we have any soreness in our ears. And then the tops of the toes, all about allergies. So this could be a wonderful area depending on the season of the year and where you live, where pollen may be high and you may have allergies. Acupressure the tops of your toes. Going to the ball of the foot, this is all about the lungs, our respiratory organs, down to the arch of the foot, all about the digestive area. The center of the foot, on the lateral aspect, we have the liver and the gallbladder on the right foot. On the left foot, a little higher, we have the heart. Again, the right foot symbolizes from the toes down, the right side of the body, the left foot from the toes down, the left side of the body. The most important thing is visit the reflexology map. Look at the map that is located on the end of your reflexology indoor mats and learn about your own body in which you're living. What I love about the self-acupressure massage of your feet every day is it is a barometer for your health where there may be imbalances. If you feel soreness, that's an area of imbalance. Perhaps we didn't eat as well, or didn't hydrate as well, or didn't sleep as well the day before. Not indicative of disease, just an area of imbalance. And then down to the heel, all about the sexual areas of our bodies and also the sciatic nerve. Then we're going to walk up the inside medial aspect of the foot where the two colors of skins come together. This is the spine of our body. So walk up 3 times, lumbar, sacral, thoracic, cervical, just mimicking the curves of our spine. And then we're basically going to stretch out the Achilles tendon, stretch up, flex down, flex up, flex down, roll the foot, both sides, twist it, and then slap it 3 times. And then switch your feet and do the same thing to the opposite foot. And after you give yourself a nice foot massage, foot acupressure massage, be sure to drink water. Chinese medicine, we have yin meridians and we have yang meridians. So it's very important as you warm up before you do qigong exercises or walk your indoor-outdoor foot reflexology path is to open up the yin meridians, all of the yin meridians located on the limbs of the arms and the inside of the legs, and the yang meridians outside of the legs, outside of the limbs. So we're going to bend our knees, turn our tailbones under, take your fist, and begin opening up the yin and the yang meridians. And you're going to do this 5 times. Just gentle knocking. You're looking for any areas of soreness where perhaps there's not flow. And that could be vascular flow, lymphatic flow, neurological flow. In Chinese medicine, we call that qi. We call that energy flow. So then we'll move to the opposite arm. Again, 5 times yin, 5 times yang, opening up the energy. And then we'll go to the outside of our legs, 5 times yin, 5 times yang. And if it's difficult for you to stand, feel free to do this from your chair, sitting down, so that you're comfortable. Most important is that you're moving your energy. Then we'll come up to the breastbone, the sternum, and you're basically the 4th intercostal space, the 4th rib at the sternum is a master point of energy. You're just going to beat that point. And then we'll come up to the top of the head. And at the top of the head, we're going to acupressure with just knock, kind of like a windshield wiper, back and forth. We have a couple very important meridians of energy in the skull. And we just want to wake those up so that we don't get colds. We also don't get headaches for lack of flow. And do the windshield wiper exercise about 4 times. And then we're going to just finish up waking up our meridians with a nice mini massage of our entire body, and that is with the ear. The ear is a mini microcosm of the entire body, an inverted fetus where the baby's head is here, the baby's back, and the internal organs in the center of the ear. So just begin, top of the ear, middle of the ear, and the lower concha, the lower indentation, and then walk up the outer helix of the ear, the outside, the spine, top of the ear, all about sinus issues or allergies. Then the back of the ear, all about lowering blood pressure. So just take your index finger and go behind the ear and end up on the lobe of the ear, which is about the brain and the eyes. Pull down 3 times, flick your ears 3 times, shake your hands out. That is a wonderful warm-up exercise of the yin and yang aspects of the body. Yin on the arms, 5 times knocking. Yin and yang on the legs, 5 times knocking. Center of the breast, bone, on the head, and then a nice acupressure of the ear. Another wonderful warm-up exercise before you do Qigong, or the 8 pieces of brocade, or walk your indoor-outdoor reflexology path, is an arm swing exercise, and it's very easy. You basically bring your arms up and back, and you do this 300 times. Now, in this society, we have a lot of issues with our shoulders, frozen shoulders. In Chinese medicine, there are 6 very important meridians of energy that pass through the shoulder joint. And what we're doing is opening up those meridians of energy. In Western medicine, we know all about the brachial plexus, very intricate superhighway of blood vessels that pass through the axial aspect of our armpit, over the shoulders, and also the nervous endings and the nerve pathways, neural pathways, and the axial aspect of the arm. So what we're doing is flow. We're encouraging flow, the lung meridian, the large intestine meridian, the internal stomach meridian, heart, pericardium meridian, all about concentration and how well we breathe and how well we digest and eliminate. So what we're doing is just standing very firmly on your feet, tailbone tucked under, and balancing on the ball of your feet. Try not to lean back on the heel, lean forward on the ball of your foot. It's a very easy but powerful exercise for increasing energy of our breath and of our digestive juices. So after the 300th, and you can start doing 50 a day, work up to 300. After the 300th arm swing, you want to bring your arms up and you want to settle the energy. Don't just drop your arms because there's a lot of power. And you feel kind of the effervescent energy, your chi that you've accumulated. Settle the energy and go on to the final exercise for warming up. Another exercise we can do to warm up before we do Qigong exercises or walk our foot reflexology paths is the side-to-side arm swing exercise. Now, we all know that Hippocrates said, let food be your medicine. In Chinese medicine, a very important meridian of energy comes up the side of our body, and that is the spleen meridian, all about digestion, how well we absorb the nutrients that we eat. So this is a wonderful exercise for absorption and for digestion. So all you need to do is plant your feet about shoulder distance apart, turn on the heel to the left, turn on the heel to the right, and you want to be sure that you're not breaking the energy of your knee and turning from the hip side to side, and then we basically turn like a puppet and our arms windmill out side to side. And if you can see the side of my body, I'm giving myself a mini massage of the spleen meridian, moving side to side, and the arms come up and windmill around and slap. This is a very common sign in the public parks in Asia as people warm up their digestive meridian, known as the spleen meridian. You want to do this side-to-side movement 5 to 10 minutes, perhaps 300 times as well. If your mouth gets dry, feel free to settle the energy and sip some water and continue again. Most important thing is that you're warming up those digestive juices and eliminating any digestive areas of stagnation in the foot before you walk the reflexology path. After the final swing, you're going to slow down, bring your feet together, and settle the energy. It's a wonderful warm-up exercise before you do Qigong or before you walk your foot reflexology path.